I'm Mary Riley,
And I'm Lauren McGinley.
we're nurse practitioners in the Child Development Clinic. And our presentation is on our non-pharmacological interventions for pediatric autism.
Mary and I have no financial interests or relationships to disclose.
Here are our objectives.
So first I thought we could start off by briefly doing an overview of pharmacological interventions. So typically medications are used to treat and manage conditions that can exist under the umbrella of autism, such as anxiety, ADHD, and aggression. Medications we usually use or typically used are SSRIs, stimulants, non-stimulants, and antipsychotics. Risperidone and Abilify are FDA approved to treat irritability and aggression in children with autism. Those are not our first go-to medications. We try to leave those for the last thing that we do just because of the risks, the side effects, and then with those medications, you do have to monitor lab work. And most of our children who are autistic don't do well when they go to the lab, so we have to take that into consideration. So it's always important to take into consideration potential side effects with any medication, and the medication should be used in conjunction with therapies when appropriate. And this is just a table that shows the more common medications that we use for our kiddos on the spectrum who need medications and what they treat, evidence supporting it. If they're off-label, a lot of what we use is off-label, and a lot of what we use is not FDA approved for all ages. So some of our little kids that we see, we do prescribe medications that are not FDA approved for their age.
So why this topic in the first place? So often we have parents, guardians of children on the autism spectrum and, children with other needs, but ask about what are additional supports, questions about complementary alternative medicine to help their child. So we wanted to kind of filter through what's out there, what is, safe, low risk, ideally evidence-based and cost efficient to help better direct our families. Of course, there is a role for medication for certain conditions, but we also like to educate them on what else is out there to help their child.
So ABA is probably one of the mainstays that we recommend for our children with autism. Applied behavioral analysis. It's a type of therapy. It's based on the science of learning and behavior. It can help to increase language and communication skills, improve attention, focus, and social skills, and decrease unwanted negative behaviors. Positive reinforcement is one of the main strategies of ABA. So the providers look for and observe the antecedents, the behavior, and the consequence. So the antecedent is what happens before the behavior occurs. What's going on in the environment, how is the child feeling, and then the consequence is what happens after the behavior. So for an example, a parent says, it's time to clean up your toys, and the child says no, then the parent removes the toys and says, okay, toys are all gone. So how would ABA help this child learn more appropriate behavior? So when the parent says, time to clean up, the child can say, can I have 5 more minutes? And then the parent says, of course you can have 5 more minutes. And then pivotal response treatment, or PRT, it's play-based and it's initiated by the child. And it is based on some of the principles of ABA. It targets pivotal areas of development, such as development of communication and language skills, increasing positive social behaviors, and relief from destructive self-stimming behaviors. Pivotal areas include motivation, response to multiple cues, self-management, and initiation of social interactions. It emphasizes natural motivation, so it's tailored to each individual's needs as well as his or her daily routines, and the focus of each session changes as the individual makes progress. So for example, if a child makes a meaningful attempt to request a stuffed animal, the reward is the stuffed animal, not a candy or some other unrelated reward. And children are also rewarded for making a good attempt, even if it's not perfect. PRT is one of the best studied and validated behavioral treatments for autism. More than 20 studies suggest that it improves communication skills in children who have autism. And in a 2017 review of brain imaging studies, it did show evidence that PRT improves brain activity associated with sociability and communication.
Um, Other therapies that often play a role in treating autism are speech therapy, occupational therapy, physical therapy. So speech therapy, as related to autism, is there to work on verbal skills, nonverbal skills, social language development. Um, a child who, might not have a lot of verbal language, but is learning how to communicate through other means like picture systems, or as you'll see below, this is an AAC device, so it's an alternative communication device, pro, low, quo, to go, which a speech therapist would help work with a family on if this is part of their treatment plan. They can also work on some pragmatic language skills, so trying to work on conversations, things like that, and children that might have more verbal language to express themselves. Occupational therapy often plays a big role as well, and it's not just to work on fine motor skills like buttons and zippers and things like that, but in the world of autism, there's often sensory sensitivities, sensory interests that might be intense. So the occupational therapist will work together with the family and the child to help develop a specific sensory diet on different things to maybe help calm their body. That could be weighted lap pads or weighted vests, possibly use of supervised trampoline, jumping on trampoline swings. They might use deep pressure through therapeutic brushing with like a special sensory brush. They'll also work, on coordination. Feeding issues, of course, is a big one too, and there's a lot of crossover because some of the other therapies too, like ABA, will touch on feeding issues as well, and speech therapy. Physical therapy might become involved to work on certain things like motor skills, strength, and balance. Toe walking, well, it's not exclusive to autism because it can occur in other conditions. It can also occur, in a idiopathic way. In autism, if it becomes severe, it might cause tightness, calf muscles or the Achilles. So PT might become involved to help prevent that from becoming too tight, to help with the range of motion. If it becomes very tight, the orthopedic involvement might also be included here.
For social skills, this is something that can help individuals with autism to help build up cognitive and language skills, focus on time and attention, direct instruction with practice in a realistic setting, support for enhancing communication, sensory integration, and learn behaviors that predict important social outcomes such as friendship and happiness. So social skills are the rules, customs, and abilities that guide our interactions with other people and the world around us. In general, people tend to pick up social skills in the same way they learn language skills, naturally and easily. Over time, they build a social map of how to act in certain situations with others. For individuals with autism, it can be harder to learn and build up these skills, so that it leaves them forcing them to guess what the social map should look like. And then play therapy is that helps to prevent or solve psychosocial difficulties and achieve optimal child healthy growth and development. Play therapy helps children with autism to engage in play activities of their interest and choose to express themselves in the most comfortable ways. So as you can see here, their therapist is on the floor with the child. They're observing what the child is doing, and then they join in. They're patient. You want to make sure you find a space where you and the child are comfortable, and you would set a timer. Um, so play needs the integration of motor, social, language, and communication skills, and this can be difficult for children on the autism spectrum. So again, it takes because it's a village. Play therapy, there's speech therapy, OT, so it all kind of interacts together. Play therapy for children with autism helps them to engage in playful activities that they're interested in. It helps children on the spectrum to decrease unwanted negative behaviors. It emphasizes trust building between the child and their therapist, and it allows the child the freedom of choice during play. And this helps them with building independence. A lot of children with autism prefer to play alone. They'll engage in selected types of repetitive play, such as lining up toys, moving objects from one particular place to another, or playing with the same toy over time. So being involved in play therapy can help give them those skills to kind of expand their interests a little, learn how to approach another child, and initiate play.
Physical exercise interventions are an interesting area. So there's a lot of different types of studies out there on physical programs and addressing symptoms of autism. The one in particular that I found that has a nice review of a lot of different physical activities is this one by Bremer. So jogging, horseback riding, martial arts, swimming, and yoga. And the one drawback of these is they're all done so differently, some with different age groups, different time lengths. So it does become a little bit hard to compare them to each other. But overall, the results show that exercise interventions can reduce stereotypic behavior. So what that means is like dimming, so like flapping, spinning, rocking, self-injurious behaviors like maybe might be biting themselves or hitting themselves, improve social functioning, as well as cognition and attention. And this is not limited to just these interventions. There's other things out there where there's like specific types of protocols developed by researchers and putting different physical activities in play. This is just kind of touching the surface on all that. And the bottom part I thought was kind of interesting is extra gaming. So a lot of children on the autism spectrum, but also not on the autism spectrum, seem to enjoy, screen times, which can have its drawbacks. But extra gaming kind of presents another outlet for children who have that interest to get that physical benefit. So things like DDR, Dance Dance Revolution, cyber cycling, the Xbox Connect or the Wii Sports or Wii Fit, which can help them to, encourage to participate in physical activity and meeting them where they're at. The other part of this to take into account is there's so many, it's a spectrum of autism. So you always have to think about the physical activity that they're going to do and meet them cognitively and adaptively where they're at. This is just something interesting locally. So Unified Sports is through the Special Olympics, and specifically for children in the preschool, elementary age group, they have heat meets. You can actually try to sign up to have them held at your school. So it's a way to get students in the preschool, elementary school age group with and without intellectual disabilities involved in like little track meets. In Virginia specifically, there's 33 areas, and it's different counties. I put the links on there if you want to look at them, and you can see different sports programs that they can have for children with and without disabilities. You'll have to check with the program coordinator on age. Roanoke is Area 8, and currently they have basketball, bowling, roller skating, soccer, softball, swimming, and track and field. There's also a local event coming up. Actually, I believe it's today, the Roanoke Big Feet Meet, and it's at Williamsburg High School. Music therapy is not exclusive to addressing, symptoms of autism. It can be used for children with a wide variety of conditions. But its main goal is to help improve nonverbal and verbal communication skills, as well as social interaction. It's a pretty low risk intervention, accessibility is probably the biggest drawback here. This thing I thought was interesting. So neuroimaging has been suggested as a means to assess why it is effective and how children or others might respond to this intervention to better understand why is it successful, what is it working on. So it's more of an area that they're hoping to become involved to better understand. I put below, this is just a local agency, Anderson Music Therapy, and I believe they're on Brambleton, and they work with children, teens, adults. They have some free groups. And again, I'm not endorsing them. It's just something that I thought was interesting to know about locally.
So animal therapy can help improve social skills and communication. It can reduce anxiety. It can provide a sense of comfort and companionship. And some studies have shown that children with autism who grow up with a family pet or a therapy animal have improved social and emotional outcomes. And then on this slide are just some pictures of different types of animal therapy. So the one on the left corner with the horse, that's Healing Strides and brings milk. They do horse therapy, and some of our pediatric therapists work with some kiddos out there during their therapy sessions. And then on the right is a little boy with a dolphin. The dolphin-assisted therapy has been used as a therapeutic approach to increase speech and motor skills in patients with developmental, physical, and emotional conditions such as Down syndrome and autism. And unfortunately, I don't believe we have any dolphin therapy in our area. And then down at the bottom is just a little boy who's at the dentist, and he has his therapy dog with him. A lot of kiddos with autism really, really struggle when they go to the dentist. It can be very anxiety ridden for them. So having this dog there with him can help keep him calm during a routine cleaning. In our clinic, we do receive a lot of requests for letters for emotional pets, emotional support animals. We technically cannot certify an animal as an emotional support pet. That is something that has to come from a licensed mental health worker. But we have had requests, anything from a dog to a cat, to a chicken, to a snake. The neurofeedback, this is a type of therapy. It's a form of brain training that helps individuals with autism by improving their social skills, communication skills, and ability to focus. A study in 2021 of neurofeedback therapy showed remarkable improvements in children's cognitive abilities. These findings advocate a correlation between amplified theta and beta ratio training, which are types of brainwaves in children, and hypoactivation of the anterior cingulate cortex is a possible neurocore problem for this impairment. So during neurofeedback, practitioners place electrodes on a person's scalp to record their brainwaves. The person's able to see their brainwaves while watching a video. The practitioners reinforce desirable changes in brainwaves, such as making the brainwaves more like those of people without autism by continuing the video. They discourage other changes by stopping the video. Neurofeedback therapy usually involves 30 to 40 30-minute sessions over a period of about 3 months. And as you can see the little girl in this video, I think she's watching SpongeBob. We also discuss a lot of this use of supplements a lot with our families. So magnesium is an essential cation involved in many functions within the central nervous system, including transmission and intercellular signal transduction. There is some evidence that magnesium can be helpful for symptoms of anxiety and depression. Vitamin B6 is important for normal brain development and for keeping the nervous system and immune system healthy. Studies with both magnesium and B6 have produced mixed results. It has been proposed that some autism symptoms may reflect neurotransmitter system deficiencies, and vitamin B6 may enhance these symptoms. In a 2017 review of 17 randomized control trials looking at magnesium and B6, the authors concluded that the use of these supplements did not improve symptoms of autism. There are some popular products in the market that our parents ask about, just our opinion of the use. So I'm not endorsing these, it's just available what's available in the market. Ollie's has kids chillax, and then there's Calm for Kids. Both of these products contain magnesium and L-theanine. L-theanine is an amino acid that can improve sleep quality, reduce stress and anxiety, and boost mental clarity.
This is another supplement that comes up a lot in conversation. So omega supplementation. So omega supplements like EPA, DHA are fatty acids that have cardiovascular benefits. So the theory behind why omega supplements could be helpful in children with autism is that it's been suggested that plasma omega-3 concentrations in children with autism would be low. There are some studies out there that show reduction in hyperactivity, fatigue, and stimming in pediatric autism, but again, the findings are kind of inconsistent. Supplement, though, is likely not harmful. Main side effects are GI upset. You just have to be cautious on families or with families that are interested in trying things like this. If there is a bleeding disorder or, of course, a fish allergy, you probably would not want to direct them towards that. Below, you'll see an example of just a children's omega supplement. And on the right, I put how to get omega from the diet. So lots of different things: olive oil, salmon, sardines, avocado, nuts, things like that. Um, Vitamin D is something else that has also come up. So vitamin D is difficult to obtain from our diets alone. We synthesize it from the sun. Um, Vitamin D supplements could possibly improve symptoms of autism per some studies. There's also been some evidence, but again, it's just some evidence that low vitamin D in early pregnancy, I believe it was below 20, and early childhood may lead to symptoms of autism. The suggested mechanisms of why treating low vitamin D could be helpful are listed on this page. The one that I thought was most interesting, though, was the vitamin D's association with these neurotransmitters. So the theory behind it is if your vitamin D is low, then these neurotransmitters may not be working as effectively. And if you'll look at what those neurotransmitters are associated with, a lot of them are social, emotional, cognitive sort of skills. So it's an intervention that may be worthwhile to look into. And a lot of people tend to have low vitamin D anyway these days.
So something else we can look at are dietary changes. So GI disorders are a common comorbidity in children with autism. Gut symptom severity appears to be strongly correlated with autism symptom severity, anxiety, and sensory conditions that are modulated by the intestinal microbiome. Abdominal pain, diarrhea, or constipation, and gastric reflux are among the comorbid GI symptoms commonly observed in individuals with autism. Children with autism are often very selective in the foods that they eat and therefore have nutritional deficiencies. So some of the diets that can be recommended are gluten-free and casein-free. This type of diet can be clinically beneficial by improving some of the absorption in the gut, which can decrease inflammation. The ketogenic diet is rich in fat, sufficient in protein, and low in carbs. In studies, researchers have found that following a ketogenic diet has shown improvements in eye contact, language focus, and hyperactivity. A study in which children ages 2 to 9 with autism were given probiotics suggested reduction in intestinal inflammation and reduction of abnormal GI microbiota. Again, compliance can be a big issue for our children on the spectrum. Most kids on the spectrum love carbs and really don't want to venture outside of that. In this picture, I just really liked, so I wanted to include it, and it just shows how the brain and the gut work together and how each influences the other. Lastly, the Nemechek protocol. This is something that some parents have brought up during visits. Dr. Nemechek wrote a book titled The Nemechek Protocol for Autism and Other Developmental Disorders. So according to this doctor, different types of nutritional deficiencies, immune imbalance, oxidative stress significantly contributes to the development of autism. He found that there is an important connection between intestinal bacterial growth and brain inflammation. So the NeoCheck protocol is a program which involves the administration of prebiotic fiber, insulin, sorry that's a typo, olive oil, and omega-3 fatty acids for controlling and reversing the bacterial growth and normalizing the inflammatory condition within the brain. So I added a picture. You can find this on the website. It's the starter pack. It is very costly. It is the extra virgin olive oil, the omega acid, and then the NeoCheck approved NeoCheck blue insulin. Um, Again, it's very important to remember the cost and benefit of anything that you recommend, or when parents bring this up. Just I always tell them to do their due diligence. Sorry, just do your research. Make sure that this is something that you're interested in. Again, there have been some studies that have shown improvement, but it's after many weeks, so it's something that you have to follow through with to see any real results.
Lastly, there's certain things, that we really do not recommend, and I just wanted to put up some organization standpoints on this. So sometimes this does come up. So certain medical interventions are sometimes used for non-standard purposes in autism, but clinical trials do not support antifungal agents, immunotherapy, or hyperbaric oxygen treatment. And there's also concern for safety, in addition, lack of supporting data for chelation therapy for children with autism. So we do not recommend that. Second thing that has come up more often in the past probably few years is questions about marijuana. So the standing statement is it recommends against use of medical marijuana for core symptoms or for co-occurring emotional or behavioral problems in children and adolescents with autism spectrum disorders. We can also not recommend that specifically for use of treating behaviors in children with autism. And here are references.
Are there any questions?
Any questions? Very good.
Thank you.
Oh, thank you.